back to Doctors in the House. It is my privilege and pleasure to be here with you, bringing you important health information. And today we're lucky to have Darryl Hill in the house, helping us understand what that role is and process is for becoming a doctor in today's age. So in the last segment, we talked a lot about what it takes to become a doctor. And in this segment, we're going to focus a little bit more on those health issues which are more focused on younger people. And we were talking a little earlier today, and when I think of young people's health issues, the one thing that comes to mind happens to be sexually transmitted diseases or infections. So we're going to go ahead and start talking a little bit about what that means and kind of go from there. So why don't you tell us what you think of when someone mentions the word sexually transmitted disease? What comes to mind for you?
Unpleasant things such as like herpes, gonorrhea, chlamydia, HIV.
Mm-hmm. Yeah, it's funny. You're right. They're unpleasant. We don't like to talk about it, but more and more these days we have to. I remember back in the 1980s when Magic Johnson came out with his announcement about HIV and how the whole world just seemed to be rocked at that moment. Of course, now, 30 years later, we have a lot of treatments for HIV, so it's not the horrible diagnosis that it used to be, but it's still a serious diagnosis. So for me, as you mentioned, gonorrhea, chlamydia, syphilis, HPV, and of course HIV are the things that come to mind. And for everybody, we got to keep these things in mind because physiologically we're always going to have some degree of interest in sex, and the question is, how are we going to protect ourselves? So when we talk about protection, what are the things that come to mind in your opinion?
They always say use protection like condoms.
You don't believe them?
I do. That's the best thing you can do. Well, no, the best thing you can do is abstinence,
right,
just not have sex. Mm-hmm. But no one's doing that. So, but one thing you can always do is get tested regularly. So in case you do catch something, you can at least get it treated right away, and then you don't have any other problems that may come from the result of you having that STD. But definitely practice safe sex.
Yeah, and I'm glad you said what you said because you got to get tested. And the CDC, Center for Disease Control, they pretty much say the same thing. Test at least yearly for younger people who are sexually active, and check even more regularly depending upon what's happening in your sexual health habits. So I guess the big question that comes to mind right now, what would you say is a high number when it comes to sexual contacts? If you had to guess, what would be considered high to you? Sexual contacts per year?
There's no number that's too high. There's no such thing as a high number, as long as you are taking care of yourself and you're getting tested, and the people that you're having sex with are getting tested as well, then it doesn't matter how many people you have sex with, in my opinion.
Well, I like the answer where you talk about, you got to get tested, and that's important. Obviously, it's funny, over the years, I've seen enough people who have been on the low risk standpoint and the very high risk. And for those people who are high risk, as I see them coming back and forth into the office where we're testing them sometimes every 2 weeks, it seems, it becomes quite clear that I'm glad you're getting tested, but let's think about modifying some of your habits, because those habits can sooner or later you can run out of your luck, and we know what happens when that happens. So I guess we can talk briefly. When you talk about STD symptoms, well, what would you say are some of the common symptoms?
You might feel sick. This is all from what I've heard. Like you might just
Absolutely. Absolutely.
you might feel sick. You might have like you might feel pain when you're using the bathroom. You might have discharge, like things like that.
Yeah, I agree. Pain, plus your pain, discharge, and sometimes you're gonna feel as normal as possible, and that's why you got to get tested. So let's continue to remind people out there, STDs are real. Get tested, because what's happening now is the reality is no one's talking about this stuff anymore, and we have effective medications so that people, if they do get certain diseases, it's easy enough just to get treated. But let's not forget about complications that come from STDs, and really, really, really important. So there was something I wanted to say about STDs. I'm kind of forgetting it right now, but what I was gonna say, it's still hard to believe that we have this PrEP therapy and all these different strategies now to say it's okay to have sex with someone who's HIV positive, or it's okay to be involved in risky sex if you're taking these pills. I want to remind people, use that medication appropriately, but don't forget, more importantly, try to minimize your risk when it comes to sex. We know now that when it comes to HIV, older people are getting it, 50s and 60s, and people young in their 20s. So be very careful when it comes to exposing yourself. Anything else you want to say about STDs?
I would say you should get tested every time you have sex with somebody new. That's what I would suggest.
That's a good point, because honestly, with young people I talk to sometimes, I say, what are you doing? When you meet a new girl or guy and it's time to maybe have sex, what are you doing to make yourself feel comfortable and minimize your risk? Any suggestions? What might work? I mean, even if you do the condom thing, what are you doing to make sure that person is as low risk as possible? Anything else?
I have to see, personally, I have to see the paper first.
Yeah, I was wondering about that. Is that really happening? I wonder sometimes. Are you saying, here are my labs, here are yours?
Yeah, because at least when I was at Morehouse, you can get the HIV result back right away.
Really?
Yeah. You get they draw your blood, or they take your blood and then they can tell you if you have it right there.
Yeah, it's crazy though. But it's the real world we live in. When I was in college, we didn't have to think about that stuff, but it just tells you how we've evolved as a society. So be safe out there, to everybody. I mean, even adults, we got to be safe too. Most of us should be in monogamous relationships, and I sure hope we are. So we'll move on now, but I'm glad we had a chance to share that information. Let's talk a little bit about drugs and alcohol. I'm not sure what the data says about what percentage of young people are drinking alcohol or using drugs, but it's safe to say that some people out there are. And when we talk about alcohol, it can be a variety of different types of alcohol. And if you have a family history, you want to be real careful, because once you start going with the alcohol, it can lead to a lot of other problems. And when we talk about drugs, there's so many to talk about. A lot of things happening with marijuana, but it's still a drug. We know about cocaine. We know about PCP. I'm just going to say to our young people, be extra careful out there when it comes to drugs, and even be more concerned with marijuana, despite what's happening in our country right now with the laws starting to change. I honestly feel like if you're a young person going to a party, I'd be careful drinking anything that's supposed to be non-alcoholic, and even be careful eating the food these days with the way they can put marijuana in food these days too. Anything else to say about that? Yeah, as a young person, have you seen, not to say you use drugs, but have you seen drugs more than you would like in party situations and stuff like that?
I wouldn't say more than I would like. I just personally choose not to use drugs.
Yeah, good. Very important. So I know we're starting to wrap up a little bit with the show. We've talked a lot about the medical school process today. We started talking on the subject of STDs and drugs and alcohol. Here's a question for you. How often do you think a young person like yourself should go to the doctor for a regular checkup?
Once a year.
Okay, I like that. Once a year. Still important, despite being busy, that you got to get out to a doctor and get checked out. The blood pressure, the lab work, all that good stuff, the vision. Yep. Anything you do to help preserve your health that you want to share with people? What are some of the things?
I try to eat the right foods, not eat fast food every day. Try to cook at home as much as possible.
Yeah, I remember when
Drink a lot of water.
A lot of water? How many glasses?
I drink probably 6 bottles a day, so it's not enough.
6 bottles? What about how many glasses? It's got to be plastic bottled water?
No. It's just easier to keep track.
Yeah. What about, when you talk about your diet, what kind of foods are you getting in?
I try to eat a salad once a day. Eat fruit, like an apple and orange a day. Try not to eat out as much. And if I do eat out, try to get something that's a little bit healthier, such as a sandwich rather than a burger and fries. But I still treat myself on the weekends and things like that. So,
what does that mean, a treat? What is that?
like eating Shake Shack.
That would be burger and fry pretty much.
Yeah.
And a milkshake too. I wonder how many calories that would be about. Milkshake, fry, burger, it's probably about 2,000 calories, but
Yeah.
I guess when you're young, you can afford to do that compared as you get older. Yeah. So I remember when I was in college, one of the big things was pizza. Eat a lot of pizza?
Not a lot, no.
Okay. Cool. What do you do for exercise? Anything in particular?
Play basketball. I need to exercise more than I do. But I feel like I look good and I feel good.
I feel good. Yeah, you do actually. You're lucky, man. Yeah, I mean, some of that stuff is genetic though, so it has nothing to do with you. It could be coming off from me. Yeah. What's the deal about the 10-pound freshman weight? You ever hear of that? You believe in that?
Most people get it. I didn't gain weight in college. I lost muscle mass.
Genetics, baby.
But
genetics.
Most people, they do gain weight in college. I'm pretty sure it has to do with their diet. The food that we get in the cafeteria isn't always the best. And then most people aren't athletes anymore. Like in high school, most people play multiple sports or at least one sport. And in college, most people are just focusing on school and partying.
So you think the students complain about that stuff when the food isn't all that nutritious, or they just go with the flow because it tastes good?
I'm pretty sure they do complain about it. But the schools need to do what they can to make enough food for all the students while also making it affordable for everybody too. So
yeah,
it's a tough challenge for them as well. But they want to make it as healthy as possible. So
have you ever had a chance while you've been in school where you had to cook your own meals and stuff like that? And if so, what kind of foods do you choose?
I would just make a sandwich.
Okay. Yeah, because sometimes you can forget how busy you are in school too. Even though you may want to cook a certain meal, you can't even do that. That's interesting, I think. Wow. Good stuff. Good stuff. Well, I think we are about to wrap up the show. So I want to thank everybody for tuning in this week. Especially want to thank our guest, Darryl Hill. Let's give it up for him for coming in and sharing with us the whole medical school process and giving us some insight into what it's like to be young and dealing with the health issues and trying to preserve your health during this critical moment in time. So we look forward to seeing you in the future, same time, same station, as we talk about a variety of other important health issues. See you next time. Doctors in the House.